St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal OTUNGA PLAZA. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmm.co.ke. You can also send an email to info@stmm.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us yet on another episode of Health Talk Show with me, Maureen Kimani, a program brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital. Well, today we shall be discussing about diabetes, and according to the Ministry of Health, at least 1.8 million people in Kenya, they are suffering from diabetes. Well, the biggest question is why, and what can be done to make sure that we can prevent ourselves from getting these diabetes. In the studio, I'm being joined by one of the doctors from St. Mary's Mission Hospital, of which he will be introducing himself in a very few time. And in case you want to join us in the conversation, sorry about that, you can send an SMS on 071-7424-866, or you can use our SMS number, that is 21760. Welcome. How are you, Dr.
I'm fine.
Good to have you here.
I'm happy to be here today.
And as our tradition is, kindly introduce yourself to our viewer. Tell them who you are and what you do in St. Mary's Mission Hospital.
Okay, so my name is, my name is Dr. Dennis Otieno Opondo. I work in St. Mary's Mission Hospital as a medical officer, and I take care of patients in our medical ward. Yeah.
Well, welcome here at our Health Talk Show. It's good to have you here.
Thank you.
Okay, let's get started with this diabetes. We've seen that around 1.8 million people in our country, they are suffering from diabetes. What is diabetes?
So basically diabetes is it's a group of metabolic disorders that is usually characterized by hyperglycemia, which means high glucose in blood. And it usually presents with various symptoms like excessive eating, excessive passing of urine, and sometimes excessive thirst. Yeah, so it's a metabolic disorder that is known worldwide, and it's usually because of insufficiency of insulin, or when the insulin has resistance, when there's insulin resistance rather.
Okay.
Yes.
And what age is prone to this diabetes?
So this is entirely dependent on which type of diabetes we are talking about. So there are two main types that we usually consider. Okay. So there's a type 1, which is basically in a juvenile population, usually between ages around between 15 to around 25. And then for the other type, which is type 2 diabetes, it usually affects adults of mostly above 40 years of age. So 40 years and older.
Okay, and which is the common type of diabetes before you tell us what's the difference between type 1 and type 2?
In my experience, I think I've seen type 2 as the most common. Most of the patients we usually see are type 2. Those are adults probably above 40. Yes.
Okay, so probably because of the age and the lifestyle?
Yes.
All right. Now give us the difference between this type 1 and type 2.
So type 1, as I had said earlier, it usually affects mostly the juvenile population, younger generation between 15 and 25. And as opposed to type 2, which usually mostly affects adults above 40 and 40 and above. But with that being said, I think it's also good to mention that over the past few years, we've been seeing an overlap of now we are even seeing younger population getting type 2 diabetes, that is around 30 years of age or even younger. They're getting type 2. So as we can see, there's a development of overlap within the years, and I can also say the same about type 1. It's not usually, we've seen adults above 30 years of age presenting with type 1 diabetes. Yes.
And which diabetes types is hereditary?
I'll say both, but the genetic predisposition mostly, we usually see it mostly in type 2 diabetes, which is usually the adult type. Yes, but we've also seen that there's genetic predisposition in type 1 diabetes. Yeah.
Okay, and I understand there is the gestational diabetes. How is it linked to diabetes?
So I'll say gestational diabetes is a diabetes that has its first onset or first diagnosis after 20 weeks of pregnancy. So it is usually, so it's just, it's diabetes, yes, but only occurs in pregnant women, and we consider it if the pregnancy has already got to about 20 weeks gestation. Yes.
And why is that?
I'll say it just like the other type of diabetes, there is a genetic predisposition of the same, and also the physiological process that goes on during pregnancy also predisposes mothers to get gestational diabetes. Yes.
Right. Now take us through some of the risk factors of these diabetes.
So as you had mentioned earlier, I think lifestyle. I think lifestyle is one of the most common risk factors. So basically, if we say lifestyle, we mean sedentary lifestyle. With the current world, it's very easy for people who work at home, people who sit on their desks and work the whole day and probably drive home in the evening. So they don't get a chance to do exercise, they don't move around so much, and I can also blame it on the kind of food that we are eating in present time. So I'm sure most of us, when we are tired in the evening, will just probably pass through food joint and get that fast food. Yeah, we don't want to eat the regular food that we've always been eating, and we can probably blame that to the increase in incidences of diabetes, even I can say type 2, especially in the younger population. Yeah.
Okay.
So other than that, other than sedentary lifestyle, so family history of diabetes can also be a risk factor that we look at. So if you have a sibling, a mother, a father, a grandfather who's had diabetes, you are more likely to have diabetes as compared to someone who doesn't have a family member with the same. Yes. To add on to that, so obesity, I think with that we can link with sedentary lifestyle, is also a risk factor. And sometimes there are types of infections, types of probably malignancies, which if they affect the pancreas, because we understand the pancreas is what produces the insulin, and insulin is very important in the development of diabetes. So anything that affects the insulin regulation, insulin production, is likely in the end to lead to diabetes.
Okay.
Yes.
What about the age? Is it not a risk factor?
Okay, the reason why age is a factor, yes, but as I've told you, the type 1 and type 2, they have different ages in which they predispose to diabetes. So for younger generation, type 1, like young age is a risk factor for type 1, and we'll say age above 40, this predisposes to type 2 diabetes.
Okay.
Yeah.
All right. Thank you very much, Dr. Otieno, for that. And what are some of the signs and symptoms of this diabetes? How can one tell I have a diabetes, apart from going to a health facility and then maybe having these checkups?
Now that I think we've mentioned that the most common type of diabetes is type 2, so I'll mainly focus on type 2.
Okay.
So for type 2, the main symptoms that we usually see, one is polyphagia, which is excessive eating. and 2, polydipsia, which is excessive thirst, and then 3 is polyuria, which means excessive urination. And we also see unexplained weight loss in such patients. Yes, so those are the classic symptoms that we usually look at when we are dealing with diabetes. Yes, and I think it crosses the border both for type 1 and type 2. Yes.
But would you say nocturia is part of the diabetes, maybe signs and symptoms?
Yes, you see, okay, polyuria means excessive urination, and nocturia means excessive urination, especially at night. Yeah, so it basically means it's almost the same thing. Yeah.
Okay, and I'm sure you have had experience at St. Mary's Mission Hospital with some of these patients.
Yes.
When they come to our health facilities, what are some of the steps that you go through before maybe we go to the treatment and other things?
Okay, something I forgot to say is for type 2 diabetes, most often it's usually asymptomatic. So by the time the patient is coming to the hospital, most times it's usually they have already developed complications. Yes, so can you repeat the question again so that I can tackle?
Okay, I was just asking now, what is your experience? Maybe you can share with the patients that have just come, because I know you have interacted with some at St. Mary's Mission Hospital. Yeah.
So, as I'd explained earlier, they usually present with the clinical symptoms that we've talked about, the polyuria, the polyphagia, the polydipsia. So when the patient comes, they say, sometimes they don't even know what is going on. And as I told you, sometimes they come with complications such as, I'd say, diabetic foot, or they present with the loss of vision, like very non-specific symptoms. But if they come with all these classical symptoms and all these complications, we ask them from the history. We ask all these questions that we need to know, from the risk factors, from the age, from the type of lifestyle that they have. So we get to know the risk factors from the history. And then on examination, most of them are usually obese. If not obese, it's just what we call central obesity, basically a very full tummy, and those are what you usually look at when we are assessing the patient for the first time. Okay. And then after the examination, we usually send them to the lab. So there are specific tests that we usually do just to confirm. So one of the...
I think before you get to the treatment, sorry for the interruptions, maybe you can tell us what health problems are associated with these diabetes.
Okay, so health problems, I think I'll discuss that as complications that come with diabetes. So the complications that come with diabetes are basically what we talk about. So first, they usually affect the eye. As I told you earlier, some of the presenting symptoms is I can't see well. Lately, I'm having blur vision. So those are usually some of the symptoms they come with. So basically, diabetes has it affects most of the organs in the body. This includes the eye, so they have loss of vision. Another thing that usually affected is the kidneys. So they usually present with what we call diabetic kidney disease. And some other complications that we usually see, cardiovascular symptoms or cardiovascular diseases like coronary artery disease. Sometimes they get ischemic heart disease. I think those are pretty much them. And then just to mention also, they also get neuropathies. So neuropathies basically means since they have uncontrolled glucose levels in blood, the nerves are usually affected. So they tend to lose that sensation. So you'll realize most of them can't feel, especially on the underfoot. They usually don't have sensation. They can even step on fire and they can't tell. Yes. So other than that, usually nerves, they're what we call autonomic nerves. So autonomic nerves is what takes care of your digestion and all this. So we realize that they have also what we call gastroparesis. The gastric system doesn't work as efficient as it should be. This is because all the nerves that basically supply the digestive system have been affected by diabetes. Yeah.
Okay, and I think with that, Dr. Otunga, we're going to take a very short break so that when we come back, you'll tell us what's the treatment being done, and if one can be able to do some of the ways like exercising to prevent having these diabetes, and what a patient who has been diagnosed with diabetes, what they can do in terms of the healthy habits and many more, right? All right, thank you to all of you for staying tuned with our health talk show with me, Maureen Kimani. Stay tuned, we're going to take a very short break. We'll be right back.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal OTUNGA PLAZA. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmm.co.ke. You can also send an email to info@stmm.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, kitambulisho Katoliki.
Hello dear viewer, welcome back to our health talk show with me, Maureen Kimani, and in the studio I'm being joined by Dr. Otieno Opondo from St. Mary's Mission Hospital, and we are discussing about diabetes in case you have just joined us right now. And in the first part we have been able to see what are some of the types of diabetes. We have the type 1 and the type 2, the age preference about that and all that. And now in our second part we shall be talking about what are some of the ways that can be done to prevent and the treatment of diabetes at all. Welcome back, Dr. Welcome back.
Thank you.
Yes, and let me just take you back in our first part. You mentioned about a diabetic foot.
Yes.
Maybe you can tell our viewer what is it all about, because we have ever had a discussion about that.
Yeah.
Tell us, how is it connected with diabetes?
So I think, as we had discussed earlier, so diabetic foot ulcer is basically a complication of diabetes. So like I told you, most of the patients, when they present, especially for type 2 diabetes, they usually present with a complication. And it's not unusual that a patient would present with a diabetic foot for the first time, and then when they come is when we diagnose them with diabetes. So basically, diabetic foot ulcer is usually because of neuropathy, which is a complication of diabetes. As we said, the nerves are affected. So when the nerves are affected, they usually don't have sensation. So this leads to what we usually call the Charcot's foot. So Charcot foot means they usually the loss of sensation, which we usually call proprioception. So when you step, there's a way your legs should adjust if your nerves are okay. But then with this diabetes and neuropathy, you don't feel anything. So you tend to put a lot of pressure on specific pressure points. So when you get these pressure points, putting pressure on these points over and over, you tend to develop ulcers. So once you develop the ulcer, because of also what we call microvascular complications, like blood can't get to the extremities well, that lack of blood supply ends up causing either the leg to because there is no enough supply of blood, nutrients to specific parts, you tend to develop these ulcers and they get worse with time. So, yeah. I think that's
all right. Thank you for that, Dr. Now take us through the treatment of diabetes, because you've been able to see some of the signs and symptoms of these diabetes now. Tell us, how is it treated?
Again, this is dependent on which type of diabetes it is, whether it's type 1, type 2, or gestational. So for treatment, usually, as we had said, the problem usually in diabetes is the insulin, either the insulin action or the insulin resistance, or insufficiency, insulin insufficiency in other terms. So for type 1 diabetes, the treatment is usually very straightforward. It's usually insulin deficiency. So you give them insulin. Once you're able to give them insulin, they are able to control their sugars well. So for type 1, the main treatment is usually insulin therapy. So the insulin therapy varies because we have various types of insulin. So depending on what you're comfortable with or what the patient would prefer is what we usually use. Yes, and for type 2 diabetes, there are a couple of drugs. Usually you don't have to use the insulin unless it gets to a point where you cannot use this oral, we call them oral hypoglycemic agents. If it gets to a point where you can't use the oral hypoglycemic agents, or they are unresponsive to oral hypoglycemic agents, that's when we consider to use insulin. So one of the most common oral hypoglycemic agents we know is metformin, which is used usually by a number. I'm sure most of the patients who, anywhere they go, even in the peripheral facility, the first drug they're usually given is usually that metformin. Yes, so metformin, it usually increases the sensitivity of the receptors to insulin. As I'd said, there's usually insulin resistance. So with this metformin, that is usually addressed. Yes.
All right. And some people do ask, can diabetes be naturally healed?
Naturally healed?
Yeah. I don't know if it's a name.
Let's say the only natural way of healing it is eating well, doing exercises, and just making sure you don't live a sedentary lifestyle. That's the only natural thing about it. Yes.
Okay, right. And after treatment, how does one recover fully? Maybe you can tell us, how long does it take? Is there a certain period of time?
So for diabetes, it's usually, now this is one of the hard parts that we usually face as medics who treat diabetes. Diabetes is not curable.
It's not.
Yes, it's not curable. But from some patients we've seen, there are patients who can easily go into remission, meaning they can go into a point that they don't need any drugs, but that usually needs the patient to be very cooperative in terms of management. So it gets to a point where just diet and exercise get the sugar controlled, but that usually takes time. But completely healing, it's very rare. I don't think I've seen that. So sometimes the sugar just becomes well controlled, but they have to continue this exercise, proper diet, and all that.
And let's take a look at the type 2 diabetes. You understand the age, it's a little bit, older age.
Yes.
And you find that when maybe the grandmas and the grandfathers, when they reach a certain age, they don't want to take this medicine. They feel it's a burden to them.
Yeah.
Have you ever heard cases about that?
I think 50% of the patients, with the patients we treat, we usually face this it's very common, because when a patient comes to you and you've diagnosed them with diabetes, and now you're trying to convince them that for the rest of their lives they have to take this medication. It's usually a very hard part of the discussion, but I think with education, patients usually find a way. They accept the diagnosis, and they accept the treatment that comes with diabetes. So actually, sometime when because we have to insist sometime that you have to use insulin, and insulin is injectable. Most patients usually don't prefer injectables. They would rather take orals. But as I've told you, for type 1, there's no way the oral medication will work. So it usually takes a bit of convincing. They come see you once, you talk to them another time, until finally they get convinced. Yes, and you have to explain it to them that if it happens that they stop medication or refuse to take, the complication just continue to get worse.
All right.
Yeah.
That's a good thing. And what's the mortality rate of these diabetes?
It's very hard to put a figure on the mortality rate, as most mortalities usually come as complications, either complications of cardiovascular diseases or renal diseases. As I said, diabetes is one of the major causes of chronic kidney disease, and neuropathies, as we had mentioned earlier. So I would say from statistics that have been taken, there's a double chance, like a twofold mortality for patients who have diabetes as compared to patients who don't have diabetes. Yes.
Right. Okay. And before we go, what can one do to prevent these diabetes? Because for the past 3 years, the research shows that young people, that is for the type 1 diabetes, the cases are rising. What can they do to prevent having these diabetes?
I would like to correct that statement. So lately we've realized that with more people are taking up the sedentary lifestyle, so it's actually the type 2 that is common in the older generation. That's the one that is coming back to younger ages. So we are seeing 25-year-olds, 30-year-olds with type 2 diabetes. Yes.
That's risky.
It's risky. So basically how to avoid it, I think we'll keep on discussing it. Diet, what you eat is usually what can predispose you to diabetes. So you just make sure you eat a balanced diet, avoid heavy carbohydrates, deeply fried foods. Those are some of the things that we can avoid. And of course, without saying, exercise. Every time, it's good to take just 30 minutes of your time, maybe at the end of the day or at the start of the day, just to do something that will help you burn more calories.
All right.
Yes.
Okay, and I understand that every year there's a set day for World Diabetic Day, that is on 14th November. Why is it important for us to have this Diabetes World Day?
Okay, so just like any other day that we usually have, World Diabetes Day it's basically a day to remember and to celebrate maybe people who have diabetes, and to encourage, basically, because as I've told you, it's a disease that it's not curable, but it needs you to continuously use that medication. So it's a day that we get people with diabetes to share their experience, maybe to encourage the ones who have not really accepted, and celebrate the ones who have managed to control it nicely. So basically it's just a day to understand, educate, and appreciate new developments in diabetes.
Okay,
yes.
And of which this year's theme is education to protect tomorrow.
Yes.
Yeah, all right. And before we wind up on our topic today, tell us for the patients that have been already diagnosed with this diabetes,
Yes.
what can they do to improve their health, health-wise habits?
So I'll simplify it. Usually we can call them 4 M's.
Okay.
So it's still basically what we've been talking about. So the first M is meal. So the kind of meals you eat. Once you've been diagnosed with diabetes, you have to stick to a diabetic diet. And this is where our nutritionists usually come in to help our clients, our patients, to know what to eat, when to eat, how frequently they should eat. Because we understand that in diabetes, they should take small meals with more frequently. Yes. So 1 is meal, as I mentioned. Then 2 is movement. Movement basically means exercise.
Yeah.
Move around, walk around. If you don't have to drive, just to walk around and get a little tired. Feel a little energized just by walking. And then thirdly is medication. This is where the problem is, because compliance in diabetes is a big problem that we're still dealing with up to today. But these patients usually need to be followed up in a clinic just to make sure that they're always in the right path. Yes. And 4 is monitoring. So basically monitoring sugars, monitoring any complications that might develop. So that is basically how you manage diabetes. I think with all those 4 M's, if you can do them, I think you can live a very comfortable life with diabetes.
All right. Thank you so much, Dr. Otieno, for that, advice and informative session with us and with our viewer out there. I'm sure they have learned a lot, even for their relatives who have diabetes. They can be able to take care of themselves, and even for their loved ones. And as we wind up, tell us, at St. Mary's Mission Hospital, if one has diabetes, when can they come to visit the clinic, and what do they need to carry to come and visit the facility?
Okay, so we have a clinic that we run, a diabetic clinic, and we have a lot of diabetic patients who we take care of. And I can comfortably say that all or most of our diabetes patients are doing very well, especially with the cooperation and with regular visits. We usually encourage them every time they come. This is what you do. What are the changes? They come and discuss with us how they've been maybe over the past month or over the past 2 months, and we're usually able to see, is this drug that we are giving okay, or do we need to adjust anything? One of the important things, we tell them to probably take regular sugar measurements, and we have a trend. We see the trend of how the sugars have been, if it's well controlled, if it's not well controlled, then we know how to adjust the medication that we give them. So these clinics are usually every day, but we have a specialist clinic that we usually have on Tuesday and Friday. Yes.
All right. Thank you all so much, Dr. I don't know if you have a parting shot before we wind up. You have something to say?
Yes, for sure. For diabetes, I have something to say. So basically, as I've said, diabetes is it's a disease that can be managed, because we've seen patients who have come from the worst complication of diabetes to a very comfortable life, just because we manage to get the good drugs for them and manage to follow them up with time. So it is a disease that can be managed, and I think it's good to encourage all those who might have diabetes or might develop diabetes to not worry about the treatment. It's something that can be managed and they can live a comfortable life.
All right.
Yes.
Thank you so much, Dr. Otieno, for that. And as you have heard, St. Mary's Mission Hospital, I would say it's the best and very affordable. You can easily access it. You have St. Mary's Mission Hospital in Langata. There's another branch in Cardinal OTUNGA PLAZA in Nairobi. And you can also access St. Mary's Mission Hospital in Elementator, right?
Yes.
All right. And with that, we have come to the end of our topic today, that is diabetes. Thank you for tuning in to our health talk show with me, Maureen Kimani. Till next time, I'm saying thank you to the Capuchin TV crew that has been behind the scene. We have Felix Juma, Fele Charles, Eric Otieno. We have Kevin Zisa and Chris Odhiambo. Thank you so much to the entire team of St. Mary's Mission Hospital, even Lydia Chanya, for organizing with this, for the Shumira and for the Peter Wawiru. God bless you. See you next time.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal OTUNGA PLAZA. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmm.co.ke. You can also send an email to info@stmm.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.